I want to thank the PR department at the hospital, at the college, and the Chamber of Commerce for this delightful weather. Great choice. Wait for the coldest day to bring us out here, and we all sit outside. So, well, welcome everybody. On behalf of the college, I'm Ray Comiskey, excuse me, President, and it's my pleasure to welcome you to our official ribbon cutting day for our clinic. And on behalf of our Board of Trustees, our faculty, staff, and especially our students, we're really glad that you're here, and we're excited that you're here to help us celebrate not only what we think has been a great operation so far, but something that has great potential for the college for years to come. Well, probably the biggest question I get is, well, why would you have a clinic at the college? I mean, we're not that far away from the hospital. There are other doctors out there. Why would you have it? And it really boils down to trying to look at the people that we work with and the people we serve, and recognizing that there was a gap between what was considered access to healthcare and true access that didn't interfere with your daily lives. And so when we started playing with the idea of having a clinic, we started looking at it from the student's perspective. And what we saw very quickly was many of them had no designated healthcare providers whatsoever. So we knew it was important that they find some access to healthcare. We started talking to our employees, and we discovered that was true there as well, that employees were frustrated because if they had to go out for some tests, they had to miss a half a day of work to get to the provider, to get the test done, possibly to come back, and that frustrated them. And then we looked at how we handled other medical issues, and we were frustrated that we didn't want people coming to work sick. We didn't want them to go with ailments undiagnosed, and especially, and finally, we really didn't want them to avoid taking advantage of the great preventive care that's available throughout our system. So put all that together, we started looking at the idea of having a clinic on campus. We had some committees look at it. We had some groups, employees and students get together, and everybody liked the idea, so we pushed ahead. So it was then that we started looking for a good partner. We started talking to Mercy primarily because, they were our neighbor, but we also knew that they had done this other places. The more we talked to them, the more we realized it was a great relationship. And so that led us into some serious discussion, and Mercy stepped up and provided us not only with some great services, but great support behind the scenes to make the clinic work. So I do want to thank Mercy for all their work and everything they've done to make this happen. I want to thank our trustees for having the foresight to let us go ahead and spend some money to make this clinic happen. I do want to thank our faculty, staff, and students who are now in the process of making this work. And so on behalf of a healthier Jefferson College, we're glad you're here today. And at this point, I'm going to turn the podium over to the president of Mercy Hospital Jefferson, Eric Ammons. Eric, come on up.
Thank you. Well, I could just say ditto to what Ray just said, because that's exactly what I was excited about. This is really a great opportunity for us, and when you look at the relationship that we've had with the Jefferson College, we have built this over the last 6 decades, and this clinic is just another expansion of that type of relationship. Jefferson College has a tremendous partner for us at the hospital. As I made rounds today, it's very obvious that we have a number of our coworkers that are working today who are Jefferson County alumni. Jefferson College continues to provide a number of skillful care workers that provide tremendous care for us at our facility. So the on-campus clinic that we have here is to continue to grow our mission to provide health care locally where we can, provide a better, healthier community going forward. So with that, we're excited about today. We're very excited about the future of working together, provide the very, very best in healthcare going forward. With that, I will turn it over to Dr. Ream and let him say a few words.
Thanks, Eric. I'm the Chief Administrative Officer for Mercy's East Communities, and I think we may have to take a collection up so Eric can afford a coat. There's a few things you can count on in life. One is that the Cardinals will be in the postseason, the Rams will not. And if Mercy's dedicating the building, it'll be very cold, so I'll be very brief. We're very excited about the partnership with Jefferson. It's such a fine institution that we are very proud to be partnered with Jefferson, and this is a big moment for Mercy. And at Mercy, we really do value quality care given in a compassionate manner, and I'm very confident that the healthcare team that we put in place in here is going to deliver on that promise. We also want to make healthcare easy. We hope the fact that it's located here for the students, for the co-workers, for the faculty, for the community at large, will be able to access this. And we want to focus on wellness, and instead of just taking care of things after the fact, try to be involved with folks ahead of the curve. And so just in summary say that we're very excited about this partnership. We really are excited about the fact that we hope to have a very long-term relationship with Jefferson College. We think it'll be good for Mercy, we think it'll be good for the community, and we trust it'll be good for Jefferson. Thanks very much.
I'd now invite Dr. Tassie Hayden to come up and say a few words about her work so far here in Hillsborough. So come on up.
Hi, I'm Tassie Hayden. I'm a family physician. I'm originally from Northwest Missouri, went to college and medical school at Washington University, and recently did a stint in Massachusetts for my 3-year family medicine residency. I'm so excited that I picked Mercy to join. I think that the way they're growing and expanding in the areas around St. Louis who really have a need for health care is amazing, and I'm so happy to be in on the ground level here in Hillsborough. My experience so far, I've been staffing this wonderful clinic space here 5 days a week for about 2 months now, and I've gotten to know a lot of students, I've gotten to know a lot of community members, and there have been days where my schedule's been packed to the gills, and I didn't take over anyone's practice. I came here with no patients. TS, not TNC. And I really think it's remarkable and speaks to the need in the community that I filled up that fast and that I've seen patients. Speaking of which, I have 3 students in there right now who need my attention, so I'm going to run back in. But I do look forward to having a long-term relationship with Jefferson College, and then of course with Mercy. And I look forward to supervising the nurse practitioner who's going to staff this clinic after I leave on December 1st, as well as, maybe coming here a few times a year to put in a day or 2 of work. I've really grown to love the community and the students. So thank you all for being here. Nice to see you.
Appreciate it. Okay, so that she doesn't have 4 or 5 patients waiting for her by the time we're done with this, we will go ahead and invite Mandy up and have the chamber set up for our ribbon cutting. And Mary, you can come up and help us out here, and Eric will ask you to help cut the ribbon. And then, assuming we can squeeze in there around patients, get a chance to take a quick glimpse at what a clinic looks like. And if the food service truck is true to form, we'll have some refreshments as well. So I'm going to turn it over to you guys. All right, ready? 1, 2, 3. Yes. Hey. And nobody got hurt. All right. Those stickers are fine.
Hey, how you doing, Richard?
How you feeling?
You're on the camera.
The problem, I had a giant